My child needs a root canal on a baby tooth, one mom told me. And I paused and asked her, are you sure a root canal on a baby tooth? She said, yes, that's what my dentist said. They said baby root canal. There is no baby root canals. There is no procedure like that. So I want to break common belief that we as a pediatric dentist do baby root canals on teeth. We do two most common procedures, pulpotomy and pulpectomy. Those are two different procedures, but they are not root canals. I'm Dr. Olga Dolghier, board certified pediatric dentist. And let me tell you, when do we do root canal, when we do pulpotomy, when we do pulpectomy, sometimes we call it indirect pulp caps, all these procedures are completely different. So when we have a mom who comes in with a little kid who has a toothache, and x-rays show a deep cavity, and that toothache is constant, throbbing, it bothers him, and the tooth doesn't show any symptoms of infection on the x-rays, we most likely gonna do one of those procedures. If it's a back tooth, we will do pulpotomy. If it's a front tooth, we will do pulpectomy. So pulpotomy on the primary baby molars in the back, we remove top portion of the infected pulp or nerve in the blood vessel of the tooth, and we preserve the remaining root portion of the nerve and the blood vessel. We do not remove the entire thing, we just scoop out the infected part. Then we place a new material we call MTA. It's a really good material, it kind of stabilizes everything and let the nerves heal. And then we fill it with a special material on top, and then we cover the whole tooth with stainless steel crown. So that is what we do for a child who has toothache with the back tooth. If I see a little kid, 3-year-old for example, and they have cavities on the front tooth which are so deep that it's almost touching the nerve inside the tooth, and the child sometimes complains on it or avoiding biting, and again there is no infection of the root of the tooth on x-ray, then we might do a procedure we call pulpectomy. Pulpectomy, we actually remove the nerve from the tooth with the special instrument, we call it brooch. We just kind of twist it out and remove the whole nerve of the tooth, and then we place again special biological material, we call it Diapex. We put sometimes MTA top or ZOE, and then put the crown on the top of the tooth. Nowadays in pediatric dentistry, we're trying to do less invasive procedures, because now we're learning that sometimes even if the cavity is very deep, we might place that new material we call MTA, and we don't need to do neither pulpotomy or pulpectomy. We would do, for example, indirect pulp cap. Sometimes we use special material we call calcium hydroxide, which kind of covers the tubules of the tooth to prevent sensitivity. And if we do have localized pulp exposure on the back tooth, we might place that MTA and then the specific calcium hydroxide material and cover the tooth with the crown. So we kind of shifting from these two procedures, pulpotomy, pulpectomy, to less invasive indirect pulp caps or direct pulp caps. This is a lot of terminology for you all, but the key point of this conversation is we do not do root canals on baby teeth. It's a common misunderstanding, a lot of debate about it. Sometimes you hear on the news saying, oh, dentists did 20 root canals. There is no such a thing. It's completely false information. If we need to do, for example, true root canal, it's usually on the permanent teeth. And if we do permanent teeth, it's usually a young adult tooth with a big cavity, and then to save the tooth we have to do that treatment we will call, for example, direct pulp cap or indirect pulp cap on the permanent tooth, and then vital pulpotomy, which is kind of preserving the internal portion of the tooth. So we're trying to, because we're dealing with a child, we're trying to do less invasive procedures, as many as possible. And now new research study shows that it's actually becoming almost like a standard of care to avoid doing, for example, pulpotomies, pulpectomies, unless child already has symptoms, then we have to do it. So that's the technically big conversation about those two most common procedures in pediatric dentistry. And if you have another question, then let me know if your kid needed a pulpotomy or pulpectomy, or do you think they needed a root canal. So big difference. Root canals adult teeth, pulpotomy, pulpectomy is baby teeth. There is no correlation between two. Thank you so much for watching. Share with me about your experience. Can't wait to see your stories.